A special warm welcome to the EIT Health Roundtable discussion series, who are watching us from all over Europe at the moment to understand in greater detail how the Germans somehow managed to get this innovation up to speed. My name is Henrik Matthies. I'm a serial entrepreneur turned somehow into this public role of managing the Health Innovation Hub in Germany. Who are we? We are a team of 15 domain experts from various parts of the healthcare sector. We are a think tank and sparring partner to the Federal Ministry of Health. We support the ministry, but also all other national stakeholders in the current digital transformation of our healthcare system, fully financed by the Federal Ministry of Health. And we dissolve end of the year, so you only have the pleasure of a couple more weeks if you want to collaborate with us. The team consists of, as I said, 15 domain experts. We have data scientists in the team, as well as interoperability experts, a former CIO of a large hospital chain, as well as an expert for medical data law. And what unites us is the true wish to transform our healthcare system into the 21st century. The German healthcare system used to be paper and pen based, very traditional, very conservative, and we managed to push in the past 2.5 years, not only us, but of course the Federal Ministry of Health and all other regulators, 28 laws to really transform our healthcare system. 6 of those laws have a pure digital focus, and they have very much transformed how digital technologies can be applied in the German healthcare system. The most famous of those laws is probably the DVG, Digitale Versorgungsgesetz, and at its core, the DVG fast track. What is it all about? How does it work? Before we had the DVG fast track, there was simply no way to enter the standard care system in Germany with your digital innovation. It didn't fit because it was either not physical, it was not executed by a human person, and many, many other reasons. So until 2020, there was simply no market access for digital innovation. Yet this changed with the DVG law, and it first of all defined a new category of health tools, the DiGA, short for Digital Health Application. A DiGA has to fulfill 4 criteria in order to be qualified as such. First, it has to be a medical device CE certified of the low-risk classes 1 to 2A under MDR. Second, it has to rely on digital technology, and that is a combination of soft and hardware, but the focus shall be on software. Third, and that was surprising when we initiated this law, it shall focus on the patient, not on the healthcare professional. So you can include the healthcare professional also in your broader service offering, but the focus of the solution has to be centered around the patient and his or her daily life. And fourth, there's a long list of functionalities, and the list is that extensive because it comprises nearly everything that you can put under those rules here, except topics like prevention or contraception. But if your product already today is CE certified, relies on digital technology, centers on the patient, and fulfills one of those functionalities, you may have a good chance to qualify for the DiGA fast track. How does the process work? First of all, it's important to know that BfArM is in charge of the entire fast track. BfArM is our German FDA equivalent, Bundesinstitut für Arzneimittel und Medizinprodukte, and they have a dedicated team who can already consult you even before you start to apply. And then if you decide you are ready to go, you have to fill out a long list of questions around general requirements, which are pretty much known to you if you have done the CE certification upfront. And there are the so-called positive care effects, and I will come to that in a minute, what is so special about that. Many digital health applications are coming from the startup scene, and they do not have yet all clinical evidence at hand when they apply. And that is okay. There is a way to get preliminary listing if you do not have all the evidence at hand yet, but a clear path towards. You need to have a study design, you need to have all your scientific partners ready, and you need to apply with that said partners and evidence design at BfArM for preliminary listing, meaning the first 12 months you can be prescribed in the German healthcare system by any doctor to any patient who is in the statutory system, and any health insurance will reimburse you. But after 12 months, you have to hand in your evidence, and then BfArM will decide if that is sufficient to list you permanently, or unfortunately it's not sufficient and you need to leave the DiGA fast track again and can only reapply under certain circumstances. So either you have all evidence at hand already and you pass all criteria, then you may be listed permanently, or you do not have that evidence at hand, but you may apply for preliminary listing. As soon as you are listed in the DiGA registry, as I said, any German doctor can prescribe you to any of the 72 million statutory insured citizens of our country. And that, of course, gives you a lot of bandwidth in terms of your clinical evidence design, because you do not need to recruit then hand-picked individuals, but you can just use all the users that you have because of the nationwide prescription rule. So the data set will get even better if you are already in standard care. You as a manufacturer may be able to set the price. That is also something pretty new. Only for the first 12 months and within certain framework that is negotiated between the manufacturers and the statutory health insurances. And you then get reimbursed by any of those said statutory health insurances. After 12 months, BfArM decides on the evidence that you have provided. You may get listed permanently, and then price negotiation start with the GKVSV, which is a very important institution in Germany. You should know about them. It's the Federal Association of all statutory health insurances, and they are going to negotiate prices with you. If you do not come to a conclusion, then there's arbitration process in place to make sure that prices may at some point arise. What is different to many other frameworks is that not only physicians can prescribe you, but also health insurance funds. If they know about your indication as a patient, they can offer you DiGA directly from the insurance. So that is something that is different to the current system in Germany. I already said a bit about the general requirements, and they are very familiar to you if you have passed the CE medical product certification process. But I want to now spend a bit more time on the evidence generation, because that is very crucial. Usually, evidence is only around medical benefit for good reasons. You should have some medical benefit in order to be reimbursable in the system. But with the DiGA Fast Track, you can also, or on top, focus on what we call structural and procedural effects. This is a new category of evidence creation where we focus on the everyday life of a patient. So how does your DiGA, how does your digital solution empower the patient towards better access of care, better coordination of care, health literacy, adherence? So you can put all those questions now also into the equation to provide a more holistic understanding of what your solution brings to the individual patient. And that includes that you are not limited to what we know as the evidence pyramid with especially randomized controlled trials, which are kind of gold standard. But you can also now include other scientific areas such as behavioral research, healthcare research, epidemiology, to get really this holistic understanding of the everyday life situation of a patient. Pricing is probably a topic that is very important to you to understand, so a bit more to that. I said that you are able to set the price in the first 12 months as the producer or manufacturer of a DiGA. Now, you apply for the DiGA Fast Track with a claim that is, of course, connected to your intended use by MDR. And that claim needs to be supported by the evidence that you generate. You set the price in the first 12 months. If you set it too high, maybe doctors will be afraid to prescribe you. If you set it too low, you may not make any revenues. But you should frame the first 12 months with your pricing. Afterwards, price negotiation happen, and those of you who are familiar with the German price negotiation around pharmaceuticals will find a lot of similarities. So the quality of evidence is of crucial importance. Can you prove your initial claim? What kind of effects do you have? Are there any alternative pricings that are relevant for your solutions? What would a self-payer pay? What are prices of your solution in other European countries and so forth? And we have quite high prices in the first couple of months since we started the DiGA Fast Track. Now it's around about 12 months in the field. And I want to give you a bit understanding why your revenue model is so different when you come to a model such as the DiGA Fast Track in Germany than it is for any other app business. App business either make a lot of money by running ads, selling data, or selling products. And here are just some illustrative examples which you probably all know. So all those apps which are free of charge, if you download it in the App Store, they of course make a lot of money with you as a user and with your data. If it comes to DiGA, it's completely prohibited to hand out any data to third parties. So you cannot run ads. You cannot sell health data, obviously. You cannot make any in-app purchases of products or similar. So the only source of revenue for a DiGA manufacturer is the DiGA reimbursement. So you have to choose that price wisely. As I said, we started the DiGA Fast Track about 12 months from now, 12 months ago. And by now we have 20 DiGA listed, a broad range of indications from back pain to mental health to oncology. 75% of all DiGA are listed preliminary, meaning only 5 of the 20 are listed permanently. All others have to prove their claim in the upcoming months. And then BfArM will decide if they stay permanently or not. The DiGA-Verzeichnis, the DiGA registry, is open to anyone. So if you just go to the website of the BfArM, you will see which other products are already listed and how they work. We see various use cases for DiGA, and the 20 DiGA that I just mentioned are already touching some of them, but by far not all. Let us start left below. Rehabilitation is, of course, something that would make a lot of sense to be supported by a digital companion, so that you do not leave the hospital and then a completely new silo starts, but that information is handed over, that you are supported during the phase of your rehabilitation, and then information also moves with you to your ambulatory care setting. There are a lot of monitoring DiGA already in the place, circling around diaries and therapy proposals. And diagnosis DiGA is something a bit tricky because you need to stay in the low risk classes. So many DiGA up to now support diagnosis as well as they support therapy. You have to be a bit careful with the legal ending there. Guidance DiGA is something that we have not seen yet, but which we would love to see in the near future. So a DiGA that supports you throughout your chronic disease. There are a few now around oncology and diabetes starting also, but that's definitely a broad field of use cases. And then support DiGA. So imagine you have a severe indication and you want to have one companion throughout the entire process, no matter if you're in inpatient care, outpatient care, and whatsoever. So this is definitely also a great field where DiGA could rise. And then, as I said, therapy DiGA. If you want to know more about the DiGA Fast Track, the best source of information is definitely the DiGA guide. BfArM wrote it. It's a free of charge PDF which you can download from their website. The link is below. And it helps you a lot to understand the entire process. If you have more broader questions to how does the German healthcare system work, how does digital health work in Germany? What is the entrepreneurial scene? Which topics do you have to take into consideration when starting a digital health business? Then we recommend you the book that me and my team wrote, especially for digital health entrepreneurs, which will be published in an English version in the next weeks. Why are we doing this? Why are we working at the moment at the Health Innovation Hub, but also why is Germany pushing so much regulation in terms of digitization? Because we need to find our own way as a European Union to take care of our health data and health systems. I personally don't want to have all my health data with a private institution, which only wants to market my data, nor do I want to have all my health data with a state-controlled institution, which may want to monitor me. I want to be in charge of what happens with my health data, and this is where Europe could have a great role and where we are fighting very much for a more harmonized digital health ecosystem at the moment. This is it for now. Thank you very much for your attention. I hope that I could provide you with some relevant information. As I said, a great source of information is also the DiGA guide of BfArM. I wish you great luck with your endeavor, with your digital health solution, and hope to see you soon, maybe in Berlin.